that we're under statewide and local mandates. And so you can see that our epi curve continues to go down. We'll continue to monitor that data. The same with our percent positivity. You can see that our percent positivity continues to trend down. This is a little bit different than the percent positivity chart that is located on our web. It breaks out the number of unique Arizonans who have received a test for the first time versus the total number of tests. So the unique Arizonans are gray bars, and our light gray bars are those with repeat tests. But you can see that the percent positivity has decreased over the last 10 weeks. When we get to vaccine distribution, you can see that the majority of the counties now are following the 16 and above or 18 and above. All counties expect to move to age 18 by Monday. Yavapai and Santa Cruz are currently doing vaccination with 55 plus priority groups and expect to shift by Monday as well. When we look at our vaccine allocation, you can see that we continue to get increases in our vaccine that is being provided to Arizona. We have we received several thousand more doses of Pfizer this week and a little bit of Johnson & Johnson. So we were very excited with the increases that we saw this week. This will now become our baseline moving forward. And we look forward to continuing to see higher doses of vaccine coming to Arizona. We've received over 3.2 million doses. And in Arizona, we've administered over 3.1 million doses, and we're almost at the 2 million mark for the number of Arizonans who have received at least one dose. So we're very excited about that. 1.2 million Arizonans are fully vaccinated in Arizona. So we continue to watch those numbers increase as we get additional vaccine into the state. As we look at our administration sites, over 1,000 provider sites now in Arizona have received vaccine and vaccine supply. This is a large, this varies between county health departments, hospitals, FQHCs, pharmacies. We've had over 1,500 long-term care facilities continue to receive vaccinations from our pharmacy partners who are participating in the CDC long-term care pharmacy partnership. And so we're very excited about that. We currently have over 490 pharmacies receiving limited vaccine supply through the Federal Retail Pharmacy Partnership Program. That includes Fry's, Albertsons, Safeway, Walgreens, CVS, Walmart, and Costco. So we are very excited to have additional pharmacies come on board and provide vaccine to Arizonans. Additional retailers as well as additional locations will be added over time. So again, we opened up appointments this morning at 11 for those that want to make an appointment at a state pod. You can schedule that either online at podvaccine.azdhs.gov, or you can call our call center at 844-542-8201, and that will connect you with a live person who can assist you with scheduling an appointment. We continue to open up new appointments every Friday for the upcoming week. Those will be filled through the end of the next week, and then we will release more appointments the next Friday. We also release daily the appointments that have either been canceled or that we feel that we've got available for that day. And so we will continue to add those to our call center for registration and scheduling. If you'd like to make an appointment at a pharmacy, you can find the locations of the pharmacy at azdhs.gov/findvaccine. Our map has the locator for all of the different entities that are receiving vaccine. You cannot register through PodVaccine at AZDHS for an appointment at a pharmacy. Those need to be registered through the pharmacies, each of the pharmacies' websites, and we do link in our Find Vaccine locator to their registration sites directly. So if you find a Walgreens or a Fry's near your house that you would like to see if they've got available appointments, you can click on that location and the website for their registration should come up. As Arizona expanded eligibility to all Arizonans 16 and above, our neighborhood pharmacies will be expanding the eligibility to meet that, the state eligibility. And so over 490 pharmacies are receiving a limited federal allocation. We will continue to add retail pharmacy locations as more vaccine is added. They are now starting to receive some Pfizer doses in addition to Moderna doses. So if you are looking to get somebody under the age of 18 vaccinated, please make sure that you are at a location where Pfizer is being administered. Our CDC long-term care program will be completed by mid-April of 2021. This was the partnership with the CDC Pharmacy Partnership for Long-Term Care. This was with Walgreens and CVS. They were provided vaccine so that they could go on site to these long-term care facilities to vaccinate vulnerable residents and staff during the 1A phase. 1,501 long-term care facilities have received over 3,200 clinic visits with 131,000 shots administered in Arizona so far. We continue to work with our pharmacy partners to make sure that if there are second doses or people change their mind, that those vaccinations will continue and there will be opportunities after April. We are also working with our federally qualified health centers. They have been onboarded and are receiving a limited federal allocation as well. And so this is to supplement those current state and local allocations. Currently 39 federally qualified healthcare centers throughout Arizona were selected to receive supplemental vaccine, and that was in Pima, Yuma, Pinal, and Maricopa. But HRSA just recently announced an additional 26 Arizona health centers will be added to this program. So again, getting the vaccine into places where Arizonans are used to receiving their health care and other vaccination services. And this will just get it out even farther into the community. Oh, sorry guys, I didn't mean. So as we've got some new announcements this week, I'm sure everyone has heard about FEMA's opportunity to provide a vaccination pod in Pima County. Today we sent a letter to FEMA notifying them that we are going to delegate the authority to Pima County to work independently with FEMA to operate a vaccine pod if they choose that that is in the best interest of their community. The only caveat is as long as it does not result in a reduction of existing vaccine supply to the state or impact state vaccine resources and operations. So the state remains ready, willing, and able to take the additional vaccine if it's unable to be used at this FEMA-operated pod, or if it is, if they are unable to meet the requirements, and we are ready to administer it at our existing state sites that have significant unfilled capacity. At our state vaccination sites, over 824,000 doses of vaccine have been administered across the state. At our state pods, we've had over 566,000 doses of vaccine administered at State Farm Stadium since it opened in January 11th. We continue to finalize plans for transitioning state sites to indoor locations while continuing to increase vaccination capacity. So as we talked last week, we continue to look at transitioning these guys into indoors. We know that it's going to become unsafe as we get into hotter weather. So as a reminder for State Farm, we will transition to overnight operations as of April 4th. The site is going to pause operations at midnight on April 3rd and then resume providing vaccinations at 5 p.m. on April 4th. And so we will continue to evaluate. We are looking at sites and are hoping to have something soon. State Farm and even overnight will continue with the current capacity of approximately 500 shots an hour. For our Phoenix Municipal Stadium at this time, it will continue to operate from 7 a.m. to 5 p.m. We are working actively with ASU on a new location that we can transition to potentially in April. The Chandler Gilbert Community College, we have an exciting announcement that was released. We will stop operations at the end of the day on April 3rd, and our new location will open up on April 5th. We are already currently scheduling the second dose appointments from Chandler Gilbert at this new site. So individuals have already been notified if they will have to go to a different location for their second site, but this indoor site capacity has a significant ability to administer up to 10,000 vaccines per day. And the University of Arizona continues to operate as they are now. They do have that hybrid site with drive-through capabilities as well as walk-up capabilities, and they have the ability to move completely indoors if needed. And they have been hitting about 3,500 vaccines this week and continue to ramp up as well. As we reported last week, Yuma Civic Center vaccination site will open this Monday. It's transitioning to a state-supported site. It will operate 7 days a week from 7 a.m. to 5 p.m., and we will partner with Yuma County, the City of Yuma, the Yuma Regional Medical Center, ASU, and other state partners to operate this new site in rural Arizona. And Dexcom indoor drive-through. So this is where we are transitioning our Chandler Gilbert Community College to. This will start on April 1st. It will operate daily from 7 a.m. to 5 p.m. and will offer up to 3,000 to 4,000 appointments per week initially. It does have the capacity for a significant amount of vaccine and the ability to operate 24/7. Again, our only limitation is the amount of vaccine that we are receiving in Arizona. We are very excited about this partnership with Dexcom and ASU and Walgreens, and we will continue to provide second doses as well as first doses for those that wish to receive their doses there. Everyone heard the announcement yesterday that we hit 3 million vaccine doses administered, and Governor Ducey announced a new phase of COVID-19 mitigation. Events of more than 50 people no longer need the approval of local governments. However, those events should continue to follow safe practices and CDC recommendations. The business requirements that we had for those businesses that had been paused will transition from requirements to recommendations. However, businesses still have the ability to continue to require masks and social distancing, as well as implement other strategies to mitigate the spread of COVID-19. Bars are allowed to resume regular operations with the ability to also require social distancing and masks, and local mandates will be phased out. So we still do encourage people to wear masks, especially if you are around those you do not live with or are in groups that are not vaccinated. We know that that does stop the spread, but we also know that it was not being mandated at the local level, and so continue to encourage everyone to wear their masks. And thank you, and with that, we will take any questions.
All right, first up is Josh Sanders.
Hi, Josh.
Hey, Dr. Chris, happy Friday.
Happy Friday.
I'm going to start with the governor's executive order. Banner Health disagrees with the order. They say that Arizona should continue mitigation efforts as we continue to vaccinate, that masks work. We've already seen bars in Tempe and Scottsdale. Even last night, one bar posted on their social media, no masks, no social distancing, full capacity, complete rager. Mayor Kate Gallego has disagreed with the governor's decision. Mayor Corey Woods in Tempe has disagreed. Is the governor's decision wrong? Are you concerned that we could possibly see another spike?
So that's a great question. And I think, you know, we could see another spike in cases, but if you look at the data, really what we were trying to prevent was an overwhelming of our hospitals and our healthcare systems. And so when you look at who was prioritized in our phase 1A and phase 1B priority groups, that was individuals that were either healthcare workers or those at high risk for developing severe complications from COVID-19, such as hospitalization and death. We had really good uptake in those groups, including those over the age of 70 or 65. those that live or work in long-term care facilities. And so we anticipate that to have a significant impact on our hospitalizations, which was really the intent of a lot of the mitigation strategies. As we continue to see cases go down, percent positivity go down, as well as vaccinations go up, that's going to even reduce that risk even farther.
But Dr. Chris, even just hours after the governor's executive order, you see a bar, several bars, who completely disregard social distancing, completely disregard mask, and say, hey, we're going to, I'll wait until they're finished, there you go. Completely disregard social distancing, disregard mask, and even said, hey, complete rager. I mean, personally, more than 16,000 Arizonans have lost their lives to this. And then just hours afterwards, you see behavior like this. And legally, they can do it. You know, they're free to do it. But how does that make you feel as the state's top position on this?
Well, we would prefer that they still followed the recommendations put forth by AZDHS and the Centers for Disease Control. We know that masking works. We know that physical distancing works. And what we would encourage is everyone to assess their risk, their risk for severe complications. And so hopefully there weren't a lot of our older Arizonans at those bars, and though they were staying physically distanced and wearing masks and not going in there. So we would like to see people following the recommendations.
To follow that, all of this is taking place as University of Arizona officials have detected a variant of the virus that was first found in the UK that is 50% more transmissible, and people experience more severe cases. So we have, variants in our state as well that are even more concerning than the initial variants. Why does it make sense then to take back these mitigations when the CDC says continue to do it, when your top hospital provider in Arizona says you need to continue to do it, and you have, health officials that just say, hey, right now, it's not the time. Give us a couple weeks before, we take back these medications. But that variant, can you speak to that variant?
Yeah, so we have been tracking variants, and we know that viruses mutate. We've been watching, what we have circulating in Arizona and what the impacts of those specific variants, if they're variants of interest or variants of concern, to see how they're circulating in Arizona. We recommend, so mandates weren't necessarily lifted. They were made to be recommendations. Everyone has a personal responsibility to wear a mask, to make sure that they're following those recommendations. And we would encourage people to do that. They were not being enforced at the local level. AZDHS was the only group that was enforcing the requirements that we had put into place, and we were actively doing that. But, it really is a personal responsibility to make sure you're wearing that mask and assessing your risk each time you go out. And the data is trending in the right direction.
Right now, it's trending in the right direction. I think we all agree with that. We can celebrate that. I think there's just concern from mayors and local officials and some other, businesses that what we're seeing just hours after this executive order, it could take us in the wrong direction. My last question, because I know others want to get there, but I want to just briefly touch on this FEMA letter from last week, and there was some disagreement there between FEMA and what seemed to be, you. They said that you mischaracterized some of the conversations you had earlier with them to the press, and now we have seen letters as well from Pima to the state when it comes to being reimbursed for testing expenses. Is Pima County and the state on the same page? What does that relationship look like right now?
So yeah, we continue to work with Pima County on their COVID-related activities. We did have a conversation with FEMA. I would say that I didn't mischaracterize it. Our primary reason for not wanting to take a FEMA-operated site is we have a ton of unfilled capacity. We have a lot of existing sites that already have the infrastructure. The requirements from either the state or the county to bring up a FEMA-operated site are significant. And we're hoping that Pima County does have the ability to provide the resources that are necessary to staff it. But it's things like pharmacy support, it's security, it's a vaccine registration system. There's a number of things that need to be provided outside of FEMA supplying it. And given the, the issues that we've had with Pima County, where there were unapproved testing activities that now they are requesting that the state pay them back for, which were not agreed upon. The state does not have the capacity to be able to refund them those for the county-specific activities that they decided to do. That does heighten our concern when we look at them operating a very expensive site through FEMA.
But just real quick to push back on that, according to the FEMA letter, they said it would be fully funded, federally fully funded. So, where's the concern coming from the dollar amount then if the federal government is saying, hey, we'll pay for everything?
Yeah, there's still things that need to be obtained, such as the cold chain storage, the communication and direct lines, the 24-hour security. And so that's one of the questions that we have. Is Pima County going to be able to wait for that to either be reimbursed? Does FEMA pay for that up front? That would probably be preferable, but those are the types of things that they'll have to work out with Pima County.
Thank you, Dr. Chris. Appreciate your work.
Yeah, you're welcome.
Bud Foster.
Hi, Bud.
Hello there, Dr.
Oh, there you are.
Can you hear me?
I can.
Yeah, thank you very much for doing this. We certainly do appreciate it, and it was nice to see you down in Tucson, in Baja, Arizona, this week. I wanted to follow up, obviously, on the FEMA decision. It's very big in Pima County. The cheering that you're hearing right now, that's coming from Baja, Arizona, and in Tucson. The officials here are very happy to hear that news today. What got you to yes? Why did you finally decide that this is the right thing to do?
Yeah, absolutely. So, Pima County has, provided their assurances that they will be able to support these sites. We are hoping that is without having any impact on any of the other currently operating sites or activities that they have planned, and to have in writing that FEMA said that this would remain. Federally allocated vaccine was reassuring, because that's not what we were hearing from state counterparts that have a site in other states on calls that we are on. So as long as they can guarantee that, and Pima County was fine providing all of the necessary resources and staffing, we will let them work directly with FEMA on that.
And also, these doses are going to be directed to an underserved area in Tucson on the south side, which has a high number of cases and a low number of people who have been vaccinated so far. I know you've talked about the 09 zip code in the Phoenix area, an area that you're targeting for the same reasons in Tucson. Did that play into your decision at all, that these are going into the arms of people who are at this point have been underserved?
That's what we would hope. Now, we know that Pima County has been working in some of those areas all along, and we are looking to work with our contractors to provide some of that high-intensity targeted communication in the South Tucson area as well.
All right. Dr. Chris, thank you very much.